Hey, Dr. Birchfield from the Chiropractic Health Center. I was evaluating a patient today, and a not that uncommon scenario came up where somebody came in with having a lot of pain in the back of their leg, kind of the hamstring area. So if this is looking at somebody from behind, like in the back of their leg, and feeling like the muscle's tight or like it needs stretched or something like that, but gets to the point where can't even really stand on that leg due to the pain. And really what's going on there is there's not a muscle pain or a muscle pull. There's actually a disc problem in the lower back that's affecting a nerve that comes out of the back, and it's a form of what's called sciatica. But it can feel sometimes like, oh man, my leg is tight or hurting or cramping, and some people think they need to stretch or things like that. In this case, when examining the person, when lifting the leg lying flat and lifting the leg, it really hurts or increases the pain to lift it, and it's clearly not a stretch pain, and it's different than the other leg. And then examine the reflexes, and one of the reflexes in the muscles of the leg where the doctor taps the knee or the ankle with a hammer and the legs kick, the reflex did not work correctly, which is a sign of nerve compression in the lower spine, a lower spine problem. So a fair amount of people out there, these things can be confusing. They have a problem. They may think it's a hip problem, a muscle problem in their leg or their piriformis or their calf or things like that. And many times these are disc herniations. Sometimes there's been a past history of back pain or something like that, and then it's kind of progressed and turned more into leg pain than back pain, so it can seem confusing that there's a back or a spine issue when the pain is predominantly in the leg at some point. If you're dealing with something like this, we'd be happy to evaluate you and see whether that's something that's related to the spine or possibly something else that could be addressed if there truly is a muscular type of problem that could be addressed in another way.